Everyone. My name is Hanan Rakeen. I'm currently the Healthcare for All co-chair for AMSA. This is my second year here, and I'd like to welcome you guys all and thank you for joining us for our week of action, which is January 13th through 17th. We are pleased to have an expert with us today to discuss Medicaid expansion, as that's one of our goals for our week of action this year. And the whole goal of this little recording is for you guys to use this recording and incorporate it into your op-ed when writing it and discussing Medicaid expansion. So what we can expect you to gain from listening to this pre-recorded webinar is to better understand the benefits of Medicaid expansion and the states that have Medicaid expansion already, how we can protect it. So again, we have Jesse with us today, and so I can just introduce Jesse really quickly. So Jesse is a Senior Policy Analyst in the Health Policy Division of the Center on Budget and Policy Priorities. In this role, he examines issues related to the implementation of health reform and provides information and technical assistance to state and local officials, providers, and nonprofit organizations who are working on issues related to expanding coverage to the uninsured through Medicaid and the new health reform marketplaces. Prior to joining the center, Jesse served as the Chief of Staff to Alaska's Senate Majority Leader, where he worked on the development of the state's substance abuse treatment programs. Jesse received his master's in public administration from the Maxwell School at Syracuse University and a bachelor's of arts in American history from Northwestern University. So without further ado, I'm going to turn over the camera and mic to Jesse so he can start his presentation. And thank you guys so much for joining.
Great. Thank you, Hanan, and thank you everybody for everything you are doing to expand access to affordable healthcare around the country. So as Hanan said, I'm going to talk a little bit about the Affordable Care Act's Medicaid expansion, some of the evidence that we know so far, about 5 years in to implementation of the ACA and Medicaid expansion, then also talk about some of the opportunities that still exist to expand coverage, and then also about some of the threats that we need to be cognizant of over the next year or so. So healthcare has been in the crosshairs since President Trump took office, especially in 2017. Healthcare was one of the most debated topics. Republicans in Congress spent a lot of their time trying to repeal the ACA and repeal the Medicaid expansion. There were a number of different bills that got floated during that year, and thankfully they all got voted down, and the ACA today remains in place. One of the outcomes of all of that debate about the ACA in 2017, which I think is pretty surprising, is that Medicaid emerged in a place where it is far more popular today than it has ever been before. So for a long time, Medicare and Social Security were considered the third rail of American politics. That is, whether you're a Democrat or Republican, conservative or liberal, you didn't want to touch those programs for fear that the public would turn against you. Since all the efforts to repeal the ACA in 2017, we have seen the popularity of Medicaid at an all-time high, and really of having a favorability as a program on par with Medicare and Social Security. So what I have on this slide is some polling information from the Kaiser Family Foundation from 2018. And what it shows is that 74% of the public has a favorable impression of the Medicaid program. And this favorable impression is bipartisan. So Democrats have an 82% favorable impression of the program, but also independents and Republicans as well have a very strong impression of the program. We think that this is because of all of the activism that occurred in 2017, when folks around the country spoke up and demonstrated their support for the program to prevent the Republicans in Congress from repealing the ACA, repealing the Medicaid expansion, and then block granting the program as well. And in the course of those debates, folks who are on Medicaid, some of the populations who are served by the program really spoke out and made their voices heard and talked about the importance of the program. So again, the Medicaid program serves a large swath of Americans. It serves pregnant women, it serves parents, it serves children, it serves people with disabilities, it serves seniors. And so even if you do not have Medicaid coverage yourself, chances are someone you know, someone in your family, a friend, has been helped by the program at some point in their life. So to talk a little bit about the Medicaid expansion specifically. So as a brief reminder, one of the core components of the Affordable Care Act was that all states would be required to expand their Medicaid programs to cover all non-disabled adults with incomes below 138% of the poverty line. In one of the ACA lawsuits that occurred in 2012, the Supreme Court changed the Medicaid expansion part of the ACA, and they said it was a state option about whether or not states would expand their program. So that meant that each state had to affirmatively choose to enter into the expansion and cover that population. Originally, about 25 states originally signed up for the expansion, and then since then there's been a slow and continual uptick, and as more and more states have joined the expansion. And one of the surprising things about the Trump administration is that while they have been spending so much time trying to dismantle the ACA and the Medicaid expansion, there has also, on the other hand, been a continued movement among states to adopt the Medicaid expansion. So even during the Trump administration, we've seen Virginia and Maine adopt the expansion. We have seen voters in Idaho, Utah, Nebraska, and Maine vote to adopt the expansion at the ballot. Very excitingly, Idaho and Utah's expansion took effect on January 1st, 2020, so 2 days ago from when I'm speaking now. And then later this year, Nebraska's Medicaid expansion will begin as well. So that leaves 14 states at this point that have not adopted the Medicaid expansion. What that means in raw numbers terms is that in these 14 states, there continue to be more than 4 million uninsured people who would be eligible, 4 million uninsured people who would be eligible for Medicaid if their states expanded. So the stakes are incredibly high, and it is very important that states continue their movement toward adopting the expansion. One of the key things that we think to consider is, so the expansion took effect in 2014. So we now have a large body of evidence and data on what the effects have been. And so what I'm going to do now is run through some of that data and some of that evidence to really show the power of the Medicaid expansion. The first way that we can track the importance of the Medicaid expansion is just by showing the difference in the uninsured rate between states that have expanded Medicaid and those that have not. So you'll see here that the uninsured rate in expansion states is, in 2018, was 6.6%. In contrast, the states that have not expanded Medicaid, their uninsured rate is 12.4%. So this gap between expansion states and non-expansion states has always been there. It has widened over time. And as the Trump administration has continued to try to chip away at the gains of the coverage under the ACA, states that expanded Medicaid, their uninsured rate has remained stable, while recently the non-expansion states have, the uninsured rate there has begun to tick up again, which again just shows really the core importance of the Medicaid expansion to preserving the ACA and to preserving the gains in coverage that we have seen over the last 5 years. So one of the criticisms that sometimes opponents of the Medicaid expansion throw out there is that they say expansion is just a card for coverage. It doesn't actually do anything if you just enroll people in coverage. There's actually a lot of evidence that shows that Medicaid expansion already has tremendous positive impacts on the health and well-being of those who gain coverage. So this chart shows some data from Arkansas and Kentucky, 2 states in the South that have expanded Medicaid. And it shows that having Medicaid expansion has made it easier for people to gain access to a primary care physician, easier for them to get a checkup, easier for them to get treatment for chronic care, or for chronic conditions that they may have. And it has also increased the percentage of people reporting that they're in good health. The evidence also shows that Medicaid expansion is a tremendously powerful anti-poverty program. So there are studies out here. This chart brings together some a couple of different studies. We pull them into one place. So research has shown that Medicaid expansion has reduced the debt, the total debt that folks with low incomes have. It makes it so there are fewer evictions among low-income renters in states that have expanded Medicaid. This is, I think, sort of intuitive, but just think it through. If you take a large group of people who were uninsured, and probably because they were uninsured were exposed to to high costs whenever they needed to seek care, perhaps in an emergency room, having coverage and having a payer for their medical bills freed up the little disposable income they probably had to make it easier for them to afford the necessities of life, like rent and food and other things like that. This chart shows a really compelling study that came out last year that looked at mortality among people with low incomes aged 55 to 64. And this was really a groundbreaking study that showed that Medicaid expansion has in fact saved lives. And it has saved tens of thousands of lives. So again, this looked at the time frame between 2014, and it looked from 2014 to 2017, and it looked at a narrow cohort of people, so age 55 to 64. And what it found is that in the Medicaid expansion states, having Medicaid expansion probably saved nearly 20,000 lives. But the flip of that, of course, is that some of the states had not expanded Medicaid. So the same study found that not having Medicaid expansion probably cost 15,000 people their lives. So these are very compelling numbers, and they're very large numbers. But again, I would just note that because it was just for ages 55 to 64, this probably undersells the effect on mortality, in which if you had looked at the entire Medicaid expansion population, age 18 to 64, you would find that even more lives were saved in expansion states, and even more lives were lost in non-expansion states. So to sort of help you wrap your mind around what these numbers mean, so if you, from that same study, if you just look at the year of 2017, and if you look at the numbers for the non-expansion states, and then think about if the non-expansion states had expanded. So if all 50 states plus DC had Medicaid expansion in 2017, it would probably have saved about 14,000 lives. That is comparable to the number of lives saved by seatbelts in 2017 in the same year. So Medicaid expansion as a measure of public health, as a tool of public health, as a life-saving measure, is basically the same as having mandatory seatbelt laws across the country. What I would transition to now is just noting, sort of going back to where I started, which is the efforts by the Trump administration and some in Congress to try to continue to undermine the ACA and to continue to undermine the Medicaid program. So what we have seen since this administration took office is that the uninsured rate has started to tick back up again after years of falling since the ACA took effect. So there are now a greater percentage of people who are uninsured in this country and a greater number of people who are uninsured in this country than when this administration took office. And we've also seen that this has happened among children. So it has happened among adults, but it's very concerning that it has happened among children as well. And some really good research by our friends at the Georgetown Center for Children and Families shows that the uninsured rate among children has continued to tick up over the last few years. The reasons for this are varied, but we think it comes from a variety of different places. It probably is a result of confusion about repeal of the ACA in 2017. Perhaps part of the public didn't know whether the ACA and Medicaid expansion coverage is still there, and so enrollment slipped there. We also believe that this is due in large part to some of the attacks that this administration has been launching against immigrant communities that has made it so immigrants or immigrant families who qualify for Medicaid coverage have been scared to enroll themselves or their family in coverage for which they qualified. And then also this administration has taken away some resources that were designated to help people enroll in coverage. So these are outreach grants to find people who are uninsured and help them enroll in coverage. So this just shows, I think, the power of the ACA and the Medicaid expansion. And it also shows the stakes and why it is so important to continue to remain vigilant and continue to remain engaged on these issues for the coming year. So as I said earlier, there are 14 states that still have not expanded Medicaid, and there are millions of people in those states who would gain coverage if their states expanded. So the stakes, again, are very high. And so continuing to work with policymakers, work with the media, work with some of your partners in those states to elevate the importance of the Medicaid expansion is a really important task for the coming year. So Hanan, I will stop there, and if you have any follow-up questions that you'd like to ask me, I'd be happy to answer them.
Yeah, perfect. Thank you so much, Jesse. That was a really great, informative PowerPoint slide, and I'm sure all of our students would gain so much just from listening to this. I was just going to ask, do you think there's anything that you think would be valuable for medical students to know specifically about this topic, or any advice for future physicians or students currently in medical school that are really passionate about expanding or adding medical expansion into their current state if they don't have it?
Yeah, I would say a couple of different things. First is just for how Medicaid expansion affects providers, particularly if they're working with populations that are vulnerable, kids, people with low incomes, people with disabilities, some of those groups, that helping those populations, getting them coverage and getting them to have a regular source of care where they can get some of their chronic conditions treated, where they can get the primary care that they need, will really, I think the evidence shows that it leads to a healthier population, and will make it easier for providers to actually deliver care and to be effective than if they're dealing with a large uninsured population. So
Right.
There's that angle on it.
Mm-hmm.
The other angle that I would note, sorry?
No, go ahead, sorry.
The other angle I would note is, obviously in those 14 states that have not expanded, they're conservative states. And so getting them to adopt the expansion is a big lift. It's possible. Like I noted, some of the states that have expanded Medicaid are some very conservative states. When you think of like Montana and Kentucky and Arkansas and Louisiana, and I could go on and on and on. So it's a policy that has been adopted by a number of conservative states and has been effective in those states. But some of the keys to getting policymakers to adopt the expansion in those states comes from having a broad-based group of voices speaking out in favor of expansion. And so that is people who, that can include people who will gain coverage, That can include the hospitals, it can include physicians, it can include nurses, and any other number of providers that speak out to talk about the importance of expansion. So having sort of that amplifying effect of a number of different affected voices, we've seen has been really impactful and really key to unlocking support for Medicaid expansion.
Right, definitely. Thank you for that. And I think one other concern that a lot of students, including myself, that I've had along the path is this like fear of feeling like we're not adequate enough to speak out about it, or like a fear of, yeah, like feeling like no one would listen to us because we're not experts. So do you have any advice on specifically how we can effectively lift up medical students' voices around these issues and for them to gain more confidence, or any like advice on that?
Sure. I would say that physicians are some of the most trusted voices on issues related to healthcare and healthcare policy. So even if you are not, in the weeds of Medicaid policy, you are the experts on the delivery of healthcare and on building a healthier population. So speaking from your own experience and how this affects your work and the work you want to do is tremendously helpful. So having your voices as part of any effort to expand Medicaid, I think is really key. And then, just to piggyback on that a little bit, having, your voice talking about the impact of coverage and how it makes affected populations healthier is really important. It can be a little intuitive or maybe too obvious at times, but just walking policymakers through why having a consistent source of coverage makes it easier for people to get the primary care that they need to treat some of the chronic conditions that they have, that will create a healthier population, that will allow kids to do better in schools, allow people to maintain their employment, allow people to gain jobs with higher wages, just connect all those dots for people, but really speak from a place of knowing how getting healthcare positively impacts people, I think is really important.
Perfect. Thank you. Well, thank you so much, Jesse, for joining us on this webinar. I'm sure all of our AMSA members that tune in would gain a ton from this, and hopefully it'll inspire and, again, educate more of our AMSA students to more about like Medicaid expansion and how we can, make a change on it. So again, if anyone listening, if you guys are interested or want to be more part of the change on the AMSA side, you can send us an email at hcfa.chair@amsa.org. It's also on like the AMSA website. If you go to the campaigns and committee section, there's all of our information. And if there's any other information that you guys are looking for, if you guys are here during the week of action or if it's after, our toolkit does have a ton of other resources. We have other sample op-eds and letters to the editor. We have some maps that were actually included in this PowerPoint as well for you guys for an easier reference. So hopefully we have enough information for you guys to gain a little bit more about it. And always feel free to reach out to us if you guys want to have a larger role, since AMSA is super on board for Medicaid expansion and, again, like all of in that regard. So thank you so much, Jesse, for joining us again. We really appreciate having you on here.
Thank you. Thank you for everything you all are doing.
Thank you.